H1N1. There have been deaths in Ohio, school closings, lots of talk about that vaccine. Today on Ohio & Company, we talk with an expert, the Ohio Education Association's Dr. Gregg Gascon. He has important insight on what you need to know to protect your family.
It's a respiratory illness that usually occurs in pigs, but it's crossed over to the humans, and we found our first outbreak of it in the spring of 2009. And since that time, it's increased throughout the world. I think on June 11th, the World Health Organization declared it to be a phase 6 pandemic, which meant that it crossed over multiple WHO areas. And then in the third week of October, President Obama declared the swine flu to be a national emergency. Well, there's 613 school districts throughout the state of Ohio, but as of the third week in October, we've only seen 25 schools close and 1 public school district. So the majority of the school closures have been in the private independent market, but it has impacted public schools as well at this point. The Ohio Education Association had participated in the tabletop exercises in 2008 when the bird flu scare had come about. And at that time, there was a great deal of discussion about the school closure issue. And we heard from some school representatives that they'd close when there was 1 confirmed case. Other ones would wait till 10%. The research is very clear that as you approach 2% of your school population being sick with influenza, school closures can be an effective means of school distancing, up to about 20%. Once you pass 20% of that population, the effectiveness of that particular control strategy really fades out. The whole idea behind school closures is social distancing. You don't want those kids to be together and keep on passing it back and forth, and then to pass to the siblings in other schools and so on and thus forth. So if a school experienced a more severe outbreak in autumn of 2009 than it did in spring of 2009, that's where we'd expect the school closure question to begin. The law and the CDC guidance all say to take a look at the impact on the social system that will occur if you have a school closure. If your kids are going home to, let's say, a rural environment where they're naturally socially distanced, that's going to be a very effective control method in that particular setting. In an urban setting, and in a setting where the parents are working, you're going to have kids collect regardless of whether or not they're at school. So it's likely to be less effective at that point. The CDC has worked with the federal government to look with the manufacturers into the vaccine question. As you know, when it hit in spring of 2009, we had seasonal flu vaccines that were available, but those proved to be not as effective against the H1N1 subtype as they'd like it to be. As far as I'm aware, the vaccines have become available and they're being sent to sites that are designated vaccine recipient sites. And then they're being distributed directly from the manufacturers to those sites and then out to local departments of health so that they can have distribution among providers. Is my child at high risk for this particular thing, and do the costs of taking that vaccine, does it outweigh the benefits, or do the benefits outweigh the costs? I think that's a decision that every person should be making with their primary care physician. But as far as the safety and effectiveness of the vaccine, they have proven to be quite effective. We've been working closely with the Ohio Board of Regents for a number of months, and they've been transmitting the same type of information as we have to the campuses. The Centers for Disease Control has a higher ed guidance piece that they've released to institutes of health education, higher education rather. And the guidance is very specific that they have to adapt the message to their different populations. Primary prevention is being stressed by every agency that we work with, from the Centers for Disease Control on down to any local health office. Hand washing is the #1 way. Covering your cough when you do have a cough. Anytime you have a sneeze or runny nose, taking care of that appropriately, and washing your hands. And what we've seen is a very good response. Some of the school districts, and for the smaller children, will invent songs. The 7-fold way of washing your hands has been very popular. The other one that we see is, as you go into the restrooms now, you'll notice that there is space for people to take a paper towel and actually open up the door so that, again, they're not exposing themselves to any flu virus that might be on there. There is a tremendous amount of resources out there. The CDC's H1N1 site at cdc.gov to me, it's one of the best sites that I've seen yet. Flu.gov is a repository of information, so it'll include things from the CDC as well as other organizations. You can download informational sheets that are on a single page that are transmittable easily to any age population. And they also have posters so that PTAs and people that work with the schools on a volunteer basis can take those in too and post that information around the school setting.
To learn more, go to the Ohio Education Association's website at ohea.org. Stay with us. More Ohio and Company is ahead.